Welcome to another CEO Wisdom Pod with Caroline Goodner. Today with us, she's CEO at Organic Care. We're going to talk about femtech, women's health, female founders, and other topics, amongst others. This podcast is brought to you by podfire.com. That is my podcasting agency. If you want to start, scale, be invited to a podcast and monetize podcasting, because podcasting is one of the best growth channels out there. A bunch of people do it wrong. They just do it for fun. There's no money in the back end. I help putting up a capitalist back into podcast so that you can pursue your passion, just talking to great people, learning from them, growing your network, and making cash at the same time. Caroline, welcome to the pod. Tell me a bit more about yourself and about Organic Care.
Okay, thank you for having me. I'm excited to be here. I am a serial entrepreneur, so I've been doing this since I got out of business school a long time ago. And so this is my fourth company, third one that I was a founder or co-founder. And so Organic Care is a company that makes consumer products in the health space, over-the-counter healthcare products. And we focus on our brand ThermaClear, which is a brand for women's health and particularly vaginal health. So any kind of vaginal health conditions like yeast infection or bacterial vaginosis, genital herpes, UTIs, urinary tract infections, we have products to help address those conditions.
It's a good niche because it's sort of taboo, but it's prevalent amongst women. Like, what percentage of women suffer from the ills you just mentioned?
Ooh, I'm glad you asked, because they are all much more common than people think. So UTIs, 1 in 2 women will get a UTI. 1 in 3 women will get a BV infection or yeast infection. And with BV, bacterial vaginosis, over half of the women will get a second infection in 6 months or less. And so these recurring problems can be just really, really aggravating and affect quality of life a lot. And then genital herpes, which is probably the most stigmatized condition of all of them, since it's an STI, and it's chronic. Once you get it, you can't get rid of it. So we have products that help with the outbreaks, but once you have it, there's no cure for it. And I think that may be part of the reason for the stigma. 1 in 5 women has genital herpes. And so, we love being able to talk about it, like on platforms like this, so that people who do have it, who kind of feel either embarrassment or shame or something like that, can stop and know that that lots and lots of people have it and they shouldn't feel that way.
Yeah, because it must suck. Obviously, I'm not the woman, but yeah, if you have these things, it's painful and it's shameful, like the internal pain of, there's something wrong with my body, and, the tabooness of sexual health and all of that. I want to start though with your career because it's quite interesting and the multiple startups you founded. Let's start with Identigene.
Okay.
DNA identification company that provides paternity testing, family relationship testing, and forensic DNA analysis to help resolve crime. Why did you started that one? And 13 years, what happened to that one?
Yeah, I started it in 1993 and sold it in 2007. So it was a pretty good long run. I started it because I knew from a relationship with my father, because he was a geneticist, and he created a new technology at the time, which was a while ago, but his technology that he developed at Baylor College of Medicine in Houston is now the technology that's used in the FBI's CODIS database. So it was a way at that time of being able to have a very robust testing system that was databaseable. So before that, every time you ran the DNA test, it was not consistent. It wouldn't give you like the same answer every time. So the technology was novel. I knew about it, so I started a company to leverage that. And I also just thought that a lot more people needed paternity tests than there was access to at that time. And so it was kind of one of the first private genetics companies focused on sort of that element of DNA testing.
Where did you grew that company? A couple millions, and did you had an exit on that one, or?
I did have an exit. So I sold to a strategic in 2007, another company that did the same kind of testing.
It must have been pretty interesting to help people know who their father was and also resolve crimes. That must have felt fulfilling.
Yeah, I'll tell you, it was one of the most rewarding things. It just felt, we were doing important stuff all the time. One quick story I'll tell you. You've probably heard about the Innocence Project, where people who were convicted of crimes, um, when they first had their, trial, but then DNA came later, and so that the Innocence Project helped prove a lot of people were innocent. We did a test on somebody who did have DNA testing at the time they were convicted. We did a test that showed that first test was done incorrectly. And so there was a crime lab in Houston that was not being run well. And so they did a lot of, bad work. And so this young man that was 16 when he was convicted of rape, we ended up proving that in fact it was not him, and he was exonerated when he was 21. So, that just feels pretty good to be part of something like that.
Yeah, I can only imagine to be accused of a crime you haven't committed, like the perception of people on you, especially when you're 16, it's like, yeah, it's life altering. So yeah, good job on that. Mendel Works, that one was short. Tell us about that one.
Yeah, that was a little bit shorter. It was a company geared toward genetic researchers that breed mice with certain genetic conditions. And so when the scientists breed the mice, they don't know exactly what the genetic profile of every mouse is, and so they have to genotype them. So we would get a little snip of their tails and genotype the mice for these researchers. But I ended up kind of turning that and selling that pretty quickly, and and decided to pursue consumer products after that.
Yeah, I saw that with Upspring, which is quite interesting. Tell us about that one.
Yeah, so Upspring, I actually was an investor, not a founder of that company. And once, I got really interested in it, got to know the founders very well. And they asked me to be CEO after a few weeks. And so I ran that company for about 4 years, and felt good that, kind of we went from losing money to making money and becoming self-sustaining. And that was during my tenure. And then I left there, and one of the founders took it back over, and they actually sold to Reckitt Benckiser a couple of years ago.
Interesting. And then you began investing in real estate, I believe.
Yeah, I've been doing that now for a while. Yeah, so just have a small portfolio.
So up to that point, I mean, you were a very successful woman entrepreneur. I'm pretty sure you know that this is like not common. So how did that feel?
Um, it feels good. Obviously, I've always been a proponent of being part of peer organizations. So I've been a member of the Entrepreneurs Organization, or EO, for a long time, and really, don't feel that unique in that sense. I mean, certainly we don't have as many women as men in EO. We're always trying to grow the female side of things, but being an entrepreneur and being in a group with other people doing the same thing sort of normalizes it for you. And it's also just a great way to work through issues and kind of get people's experience who maybe done the same sort of thing and face the same kind of problems.
And then organic care, how did that came about? You did some market research and we are like, okay, I'm gonna jump right into this.
Actually, so I have two other co-founders, one gentleman from Italy and one that's here in Austin where I am as well, who has a medical device company. And so they actually were paired up already. Our Italian co-founder had the technology. And so he had a technology that is, prevalent in all of our products, topical products today. And it was used in Italy as a prescription for really chronic, persistent wounds like bed sores or diabetic ulcers, or really, nasty wounds that don't heal. And so this was a topical product that could be put on, and it, helped these kinds of wounds heal. And so the idea was, let's bring it to the US and sell it to the consumer market. So those two guys kind of found me as someone who had run a consumer products company. They needed the operator, the CEO. And so that's what they found me. And we kind of joined forces and co-founded it together. But I was not I didn't have the technology that came from Italy.
So what does the business look like nowadays? How many people buy from you? What's your volume?
Um, Gosh, that's a good question. I mean, we sell nationally in the drug channel, mass, Walgreens, Walmart, Rite Aid, all those. And we have about 18 SKUs now. They're not all in national retail, mostly our treatment products, but we also sell, of course, on Amazon and our own D2C site. So millions of products. And it's going very, very well. These are under-innovated areas of women's health. There's been a lot of talk about that lately. It's gotten more attention, the fact that there's been less innovation for women's health conditions. And so, bringing something that's really unique and different feels good. But a lot of other kind of developments now in the fem health space tends to be more personal care or kind of those kind of products, and these are real treatment products that help address these conditions that are super common.
And how do you grow the company? Is it just like more retailers, more partnerships? And how do you get into more retailers?
Yeah, I mean, there's three ways that we grow the business. One is, kind of sell more off of the shelves that we're on, like, a faster velocity is what we call it in the consumer product space. Number two is get more doors, more stores that carry your products. And number three is make new products, kind of add to our portfolio of products. So those are the three main ways that we are growing.
Right. And okay, so precisely how do you get into more retailers? Do you just call people that have specific titles into these companies? Do you present them the product? Do you do Zoom calls and then show up physically to their HQ and present? Like, how does that work?
Yeah, it's a good question. We do have people in-house, and some people use distributors or brokers, and we really like to own the relationship with our buyers. So the buyers, depending on the retailer, they'll have a buyer that's specific to your category. So we're in the fem health category, or could be the sexual wellness category in the case of our herpes product. And so we will establish a relationship with that buyer for that retailer and, kind of talk to them. And at this point, in our stage, we cultivate those relationships over time. We try to provide them good education. We try to partner with them and do different things in the different retail chains based on what they need. And so, we try to look at it as kind of a partnership relationship. And we don't sell everywhere we could sell. Like, we want to make sure that we're in the right type of retailer that makes sense for us, because everything takes time and energy, right? And so you want to be in those retailers where consumers are most likely to look for your type of solution.
Right. In terms of awareness for ladies, what can we tell the youth so that, yeah, they don't get these sexual infections?
Use protection, be careful, get tested, as often as you can. If you're having multiple partners, just be careful and use protection is the best, use a condom. That's the best way to prevent the spread of STIs.
And why can there just be like some pill that you take and it eliminates these types of infection, like one shot?
Depends on the kind of illness, certain ones. A course of antibiotics will clear things up, like chlamydia or gonorrhea is actually tough because it's become resistant to antibiotics now. So that's a much tougher one to eliminate. But something like herpes, like I said, once you get herpes, you have it for life, but it's really not, I mean, it's a very manageable condition. So, people will get outbreaks and things will trigger, outbreaks like stress or your diet or, different people have different triggers. And we just try to help people manage that. We have, a supplement that has a clinical dose of lysine in it that if you take that every day, that's more likely to stave off outbreaks. But again, the virus stays within a person that has it, but you can minimize your outbreaks. And if you don't have an outbreak, you really don't have any symptoms of the disease.
Right. And my question for you is how, as the CEO, how do you make sure that the company keeps on growing? For example, when the market is, the economic conditions right now are not too good. I mean, people won't stop having herpes or these viruses, these sexual illnesses, but how do you make sure to keep on growing? What's your priorities on a day-to-day?
Yeah, I mean, it's really putting a plan in place and making sure you execute on it well. And so it's having smart people and a good team, which I think we've got a very strong team. And, kind of just doing planning and determining where are the best ways we can invest to grow, to make sure more and more people know about us. We're still a young brand. Femiclub has only been around since 2019. And so, we're still very much trying to get the word out that these alternatives exist to prescription or to, kind of the big brands that are in the yeast infection space. And how can we be as efficient as we can with the marketing dollars that we spend? That's really a lot of what we focus on.
And where do you spend these marketing dollars? Facebook ads, just to make people aware that you folks exist? And then since it's in the sexual wellness space, how do you make sure that people are not uncomfortable viewing these ads?
Yeah, it's a really good point, and certainly one of the things that's come under fire is advertisements that talk about these kinds of subjects that a lot of people don't want to talk about or don't want to hear about have been blocked. And so there's been a bit of a contentiousness with feminine health brands and Meta and even TikTok and these different platforms that have, I guess, rules around what can and can't be advertised. But I think that some of that stuff is changing, but I know that a lot of ads have gotten blocked in the past, and so we're kind of fighting the fight that no, these aren't taboo subjects that shouldn't be talked about. They should be talked about, even if they contain the word vagina or something like that. So yeah, we try to be effective with those ad spends because it's important to be where what people are consuming, and we know that our consumers are on social media a lot.
My first business was a natural product. I think our margins were like around 70%, everything considered equal. Are your margins around that? And at this point, is it $15-20 million business a year?
Our margins are great. Yeah, they're 75% plus, mostly because we make them ourselves. So we're a bit unusual in that regard. Like even much bigger companies than ours will still outsource the manufacturing. We outsource for our supplements and washes, but we make all of our topical treatments in-house. And we have a proprietary patented tech. And so that's been a big benefit to us. And yeah, we're north of 10 now in revenue and hoping to grow.
Right. What are your top goals for 2024?
Yeah, I mean, we have financial goals. We also have some sort of product improvement goals. We've come up with a new formulation that we think will address some of the issues that a small percent but an important percent of our consumers experience, which when you have an infection like that, you've got sensitive tissue, vaginal tissue, and it can hurt. And so we've gotten a new formula that we think it will hurt less and continue still kind of cure the infection, fix the problem that the person has, but do it in a more tolerable, pleasant way. So we have those goals, and of course we have financial goals and objectives that we want to reach, plus new product development goals.
What will be the next big challenges for you folks in the next 5 years?
I think, just there's a lot of interest in the feminine health space. And I think staying relevant, staying different, and being heard, kind of getting noticed and continuing to kind of build our scale. There's a lot of companies that don't make it past, 1 million or 5 million or 10 million. And so, the more we can grow and scale and be, and stabilize over time, I think that's the key to just hitting those milestones.
Where can people find out more about you, Caroline?
Femiclear.com.
Charles Cormier as your host. I was another CEO wisdompodcast.com with Caroline Goodner.